Cases of COVID-19 are rising in virtually every region of the country. These are the active cases in Canada based on yesterday's numbers. Quebec, Ontario, and Alberta have more than 10,000 active cases. Alberta has the most, closing in on 14,000. That is more than Ontario, which has over 3 times the population. Yet Alberta has done the least to impose restrictions to stop the spread. In Calgary now, intensive care units are operating at overcapacity. The statistics, of course, aren't just numbers, they're people. And one of them is 40-year-old Ricky Lam from Edmonton. His family says he was diagnosed with COVID-19 on a Thursday and died a few days later. To their knowledge, he did not have any underlying health conditions. Heather Yourex-West now on the human toll in Alberta as the virus keeps spreading.
Always full of life, always out exercising and energized and dancing on the dance floor and sweating it up.
Over the course of 3 days, Edmonton's Ricky Lam shared his symptoms on Instagram. At emergency because my breathing has suddenly gotten worse, reads the first post. Later, X-ray is apparently showing signs of COVID. He would later share he tested positive. And 3 days later, in his final post, breathing has become very difficult. Every few breaths I go into a coughing fit. It's so brutal, it doesn't allow me a chance to recover. At just 40 years old, Lam died the next day.
We're now at a situation where this has a life of its own.
Intensive care units across the province are now at or near capacity, and those on the front lines fear the number of deaths from COVID-19 will begin to sharply rise.
Certainly, in my view, the measures that have been put in place are very weak.
This former Alberta Chief Medical Health Officer also believes that recently announced restrictions don't go far enough.
That failure to be able to count on contact tracing means that we should be pivoting to the second strategy, which is the kind of lockdown we saw and that was effective in the spring. And so that's what I would be pushing for.
For many decisions, I present a range of policy options to government officials, outlining what I believe is the recommended approach. The final decisions are made by Cabinet.
Dr. Dina Hinshaw has not said publicly what her recommendations to government were, but according to her predecessor, if there was conflict with government, there is little chief medical health officers can actually do.
It's a core competency of public health to be able to speak truth to power. But there is virtually no protection for the people who do that. So you can be dismissed without cause almost anywhere in this country on the whim of the government.
A difficult situation that ultimately the virus will judge, reflected soon in the number of new infections and patients requiring hospital care. Heather Yourex-West, Global News, Calgary.